Hi, I just want to tell you some possible differential diagnosis of abdominal pain. So someone is having abdominal pain, what could be responsible? Let's go. If it's the upper part of the abdomen, it could be pancreatitis, inflammation of the pancreas, could be gastritis, if it is affecting the stomach, could be duodenal ulcer, could be hepatitis, could be gastroesophageal reflux disease, liver abscess, splenic abscess or infarct, biliary colic, could be gastric ulcer also, could be something dangerous like aortic dissection, could be myocardial infarction, angina pectoris, myocarditis. All those are found in the upper parts of the abdomen. So the abdominal pain and the upper parts of the abdomen could be anything along those ones mentioned. If it is lower part of the abdomen, could be appendicitis. The pain started from around the black cause and is now localized in the right iliac fossa. Could be intestinal obstruction. Could be ectopic pregnancy if it's a woman of childbearing age. But there will be other histories that will follow, like missing your menstrual period and the rest, pelvic inflammatory disease, if there's infection here before, vaginal discharge, fever, and so on, ovarian torsion or ovarian abscess, hernia, something is protruding when you cough or sneeze, diverticulitis, if it is the left side of the iliac fossa. Could be renal stone, could be urinary tract infection, burning, urine, fever, urinating more frequently, and could be renal cell carcinoma when individual is losing weight, blood in urine, could be inflammatory bowel disease like Crohn's or ulcerative colitis, could even be irritable bowel syndrome that's associated with pain or mesenteric ischemia in someone with hypertension or atrial fibrillation, middle age or elderly, having pain that is not proportional to whatever you think the diagnosis is at the time. Could be secondary to trauma. Maybe somebody punched this person right now, or bull, cow punching, or accident, or anything. Any form of trauma could give abdominal pain. In brief conclusion, contact your doctor. It may be nothing serious. That determination will be made after checking you. So many questions will be asked to make diagnosis of each of those items I listed. Thank you for watching. We'll talk more on each of those differential diagnoses in future. Thank you.